Four important points in the definition of asthma are: number one is chronic, second, inflammatory, third is recurrent, and fourth are the symptoms. And the most important one is the wheezing. Other symptoms include breathlessness, chest tightness, and cough. So, asthma is chronic inflammatory disorder of airways that causes recurrent episodes of wheezing, dyspnea, that is also known as breathlessness, chest tightness, and cough, mostly past at night or early in the morning. As I have told that it's an inflammatory disorder, so the inflammatory cells must be present at the site of airway. So they include eosinophils, neutrophils, macrophages, lymphocytes. Mast cells and epithelial cells are also present. Next, there can be an episode of asthma and it is completely recovered, and then there is a gap of with no episodes, and then another episode occurs. So it's actually intermittent and reversible, and airway obstruction occurs in asthma. Second, chronic bronchial inflammation occurs, and it is in case of atopic asthma, it is associated with mostly with eosinophils. Bronchial smooth muscles hypertrophy and hyperreactivity also occurs. An increase in mucus secretion occurs by the increase in number of the goblet cells and the mucus glands. Okay, now let's move toward the pathogenesis. So there is genetic predisposition to type 1 hypersensitivity, acute and chronic airway inflammation, and bronchial hyperresponsiveness. So the bronchospasm can be triggered by exposures. Yes, it can be viral respiratory infection, upper tract. Okay, it can be airborne irritant that can trigger bronchospasm. Cold air, stress, and exercise can also serve as triggers. So what actually happens? There is increased activation of type 2 helper T cells. Cytokines are produced. They include interleukin 4, 13, and 5 mostly. So these two, 4 and 13, they are involved in the IgE production, and they call them as cells, and you all know the process, whole process. Don't need to repeat it here again. The 5 is mostly causes the eosinophils chemotaxis, and the 13 causes an increase in mucus secretion. So first there is early phase and then late phase. In the early phase, bronchoconstriction, mucus production, increase in mucus production and visualization occurs, and the mediators involved are these. And in the late phase, inflammatory mediators cause the epithelial cells to produce further chemokines, and these chemokines attract further cells that includes that helper T2 cells, eosinophils, and other inflammatory cells. So these repeated bouts of inflammation causes structural changes in airway wall that is known as airway remodeling. Like, what are the changes? So there is hypertrophy of bronchial smooth muscles, an increase in number of mucus glands, vascularity increases, vasodilation occurs, permeability increases, and the formation of new vessels increases. So in case of increasing the number of vessels, the factor mostly involved is TGF alpha. There is also deposition of subepithelial collagen, and here the factor that is mostly involved is TGF beta. So now let's move towards the types of asthma. First we have atopic asthma. So it's actually type 1 IgE mediated hypersensitivity, and mostly it starts in childhood, and there is family history, and it is preceded by allergic rhinitis, urticaria. Next, it is triggered by allergens, and eosinophilia is present. Skin test is positive, and it can be diagnosed by radioallergy survey test that detects IgE antibodies. Next, we have non-atopic asthma. In this, no allergen sensitization is present. That is in contrast with the atopic asthma. Here, skin test is negative, but in case of atopic, it is positive. Family history is positive in both. And the upper one is mostly triggered by allergens, and the lower one is mostly triggered by viruses and stress, exercise, air pollutants. Okay. Next is mostly it is more neutrophilic as compared to the above one, which is eosinophilic. And drug-induced asthma, that is caused by aspirin sensitivity. Okay, so here in this, recurrent rhinitis occurs, nasal polyps, urticaria, and bronchospasm are the important features. Other is the occupational asthma, and it can be triggered by fumes. It can be caused by gases, chemicals, organic and chemical dust. Now let's move toward the morphology. So airway trapping can occur, and smaller areas of atelectasis can occur. The mucus plug that is formed because by the increase in the mucus secretion can cause occlusion of bronchi and bronchioles. And the shed epithelium can form holes, and they are known as Curschmann spirals. Here, eosinophils, they are involved in inflammation there and are present. And this is galactin 10. It's actually a protein that is present in the vesicles in eosinophils. So, thickening of airway wall occurs, subbasement membrane fibrosis, that is caused mostly by the deposition of collagen type 3 and type 5. Submucosal vascularity increases, increase in submucosal gland and capillary cells. Metaplasia occurs. Hypertrophy and hyperplasia of bronchial muscles, these are actually the airway remodeling components. So, hope you will like this video. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.